Hello, my name is Dr. Fahim Khan. I'm a consultant rheumatologist at the University of Pittsburgh Medical Center in Ottavan Hospital, Kilkenny, Ireland, where I practice rheumatology, and apart from rheumatology, I practice pain medicine as well. So I practice scrambler therapy, which is also called Calmare therapy. So let me talk to you what is Calmare therapy. So Calmare therapy is a device which you can see it here in the background. This is the Calmare therapy device. We use this device to treat pain conditions. So let me give you a background on Calmare therapy device, what this device is, and how do we use it for pain medicine. So you can appreciate that this device has these 5 cables, electrodes coming out. It has these channels. This is where we set up the treatment for each patient to treat pain conditions. So let me fill you in about Calmare therapy. So Calmare therapy or scrambler therapy is treating pain without the use of medications. This sounds very promising because there are patients who are on big doses of drugs. They're quite serious pain relief medication like opioids, and unfortunately nothing works for the patient. Excuse me. So Calmare therapy device it's actually a US FDA approved device and also European clear device as well that is approved for pain management. So what kind of pain condition that we treat? The pain condition that we treat, FDA approved it initially, was for nerve pain and cancer oncological pain. But over the years, since 2010, a lot of uses of Calmare therapy have been, now we have seen that benefit the use of Calmare therapy for patients. For example, patient suffers from neck pain, back pain, fibromyalgia, numerous types of nerve condition, phantom limb syndrome, and so on. So let me talk to you about how Calmare therapy works. So Calmare therapy treats using a biophysical rather than a biochemical approach. For example, a no pain message is transmitted to the nerve via these disposable nerve electrodes applied to the skin in the region of the patient pain. The perception of the pain is completely gone once we attach those electrodes where the pain is coming from. We keep the electrodes away from the source of the pain. And this machine is designed to send impulses, which are pain-free impulses. They travel through the same nerves that transmit the pain, thus blocking the pain or overriding the pain, so no pain is felt by the brain. We give daily sessions. There's a course of treatment which is 10 sessions. It varies, each duration varies from 30 minutes up to 45 minutes to an hour, but in some patients, like fibromyalgia patients, we use 20 minutes as well. So 20 minutes is the least amount of time spent. Maximum time mostly is 30 minutes to 45 minutes in patients who have nerve-related pain. So there are no known side effects with this treatment. It gives you immediate pain relief, and patients find this treatment very tolerable. So when these surface electrodes are attached to the skin, when we switch on the machine, it gives a small kind of these sensations of sharp pins, or somebody said like electrical bees applied to the skin, but they do not sting. So these are sensations. Perhaps the nearest example I could give it to you would be if you have had a TENS machine treatment, mostly used for myofascial pain. It gives similar type of sensations given to the skin, but it's totally different. So TENS machine is totally different than this Calmare therapy machine. So we see great improvement from nerve pain, and there's some condition like neuropathic pain, for example, complex regional pain syndrome or reflex sympathetic dystrophy, which is a condition very common after an injury to a limb, or after a fracture, or after a cast is removed, post-surgical, after sprains, ankle sprain. It affects nerve pain type of symptom, burning, agonizing pain affecting the limb. with color changes, soft tissue swelling, and realistically, there's no known cure for it because patients are put on many serious drugs. They're neuroleptic type of medication, which has potential for side effects because all these medication, for example, pregabalin, gabapentin, when it is used, it does not really treat the pain. It might help to a certain extent, but at the expense of serious side effects, dizziness, grogginess, and so on. Opioids have also side effects, but the Calmare therapy has been shown to be over 80 to 90% effective in patients who have neuropathic pain, particularly complex regional pain syndrome or reflex sympathetic dystrophy. I've used it for patients with complex regional pain syndrome or CRPS, and most of 90% patients do very well. But in 10% of patients, that does not mean it doesn't work. We treat them differently because normally it's 10 sessions are given. Each session is given daily, Monday to Friday, perhaps weekend off, then Monday to Friday, 2 weeks. Or 80 to 90% of patients have success rates. So if figures quoted by most of the Calmare therapy provided would be 85% plus or 90% plus success in the treatment of CRPS, complex regional pain syndrome or reflex sympathetic dystrophy. There are many other conditions like nerve conditions which also show good response. Post-chemotherapy induced nerve damage. So after chemotherapy, the nerves can also be damaged. It's called peripheral neuropathy, chemotherapy-induced peripheral neuropathy. Calmare therapy is also very effective in patients who have diabetes causing damage to the nerve because of the high blood sugars. We use Calmare therapy, scrambler therapy for the same. Then there are conditions, for example, shingles pain, post-shingles or neuropathy. That is also very effective in patients when we use Calmare therapy. Conditions like trigeminal neuralgia, which is a fifth nerve here, causes severe pain, jaw pain. This Calmare therapy has been highly effective in patients treated with trigeminal neuralgia. Patients who suffer from lower back pain, the pain travels into the leg, a condition called sciatica, which pins and needle numbness, weakness of the legs. And if there's no surgical indication, acute spinal cord problem, and if we have to use pain relief, Calmare therapy is quite effective without the use of drugs, without the use of any medication. If there is a nerve involvement, it works really very well. So apart from these are the most common nerve condition that we see. A condition affecting the back pain, for example, chronic back pain, failed back surgery, Calmare therapy really works very well for it. Neck pain, or nerve-related neck pain, which is called cervical radiculopathy, which the pain shoots into the arm with pins and needles, weakness, numbness. Brachial plexus pain, brachial plexus neuropathy, injury to the brachial plexus. These are the nerves in the armpit areas coming from the neck. Calmare therapy is very effective for brachial plexopathy. So these are the quite common conditions that we use for the Calmare therapy to treat patient pains, and the pain scores remain to be always quite low. I've seen some patients, literally speaking, their pain scores are 0. Some patients will have symptoms, for example, a nerve damage causing numbness, let's say numbness in the hand. When we place these electrodes, Calmare therapy, and after a few sessions, they would actually regain their sensations and the numbness is completely gone. So that's very reassuring that what we see from the patients after we treat them with Calmare therapy. Are there any other condition that we use Calmare therapy for? Phantom limb pain, phantom limb syndrome. Calmare therapy is quite effective. I use it for patients who have fibromyalgia. Fibromyalgia is a common condition. It's aches and pains. It's a pain disorder, fairly common condition. Calmare therapy works very good for patients who have fibromyalgia without the use of drugs. So Calmare therapy has been tried in patients with fibromyalgia. There's a condition called myofascial pain syndrome. So myofascial pain syndrome is pain affecting one or group of muscle. Mostly we see it on the upper back, neck, and back area. It can occur on its own or in combination with fibromyalgia. So apart from treating this condition with the usual trigger point injections, physio exercises, which of course remain to be the mainstay of treatment. For pain relief, you use the Calmare therapy. The electrodes are attached there. When you switch it on with the course of treatment, myofascial pain also improves from pain point of view. So these are mostly the categories of conditions indication that we use Calmare therapy for. So Calmare therapy is highly effective. No pain is felt during the treatment, and it gives immediate pain relief. So when we switch on the Calmare therapy and patients have nerve pain, the nerve pain perception is completely gone and they don't feel any pain except they feel the sensation of Calmare therapy. And as the treatment goes on, we see Calmare therapy dominates the pain impulses, and patients tend to forget their own pain impulses. There have been studies done in which they found out that if the pain score was 8 out of 10, the duration is, let's say, 2 weeks. From 8 out of 10, the average pain scores achieved at 2 weeks was 3, probably 4 out of 10, but there are patients who have zero pain as well. Some patients, however, require booster sessions. And these are the patients that they tend to have fluctuation of the pain after the treatment is finished. And booster sessions can be given instead of going through 10 treatments, up to 2 to 4 booster sessions are given. And then they remain pain-free for 6 months to a year. So average patients who have Calmare therapy, they're successful with the treatment. They remain pain-free 6 months to 1 year, or maybe longer. The patients who have pain relief for over 4-6 years. But if the pain comes back and it is a troublesome pain, let's say a numerical rating scale, the pain scores are 8 out of 10 or over, I would recommend booster session, and if it persists at that level for a few days. So patient who finish the treatment, for the first few phases that I've seen with my experiences, for the first few weeks after that, let's say post-treatment 6 to 8 weeks, there could be slight fluctuation of the pain. But if the pain scores remain persistently elevated 6 to 8 weeks later, it gives a good indication for us that, well, the patient will need some booster session, and we bring them back. We provide 2 to 4 sessions, mostly average 4 sessions of Calmare therapy. In cancer pain, oncological pain, Calmare therapy is also very effective. And studies have shown that it helps the pain. The patients do not need to stay on strong painkillers like morphine and so on. Some cancer pain, unfortunately, patients are on morphine pumps to kill the pain. And in patients who have cancer pain, we treat them for at least 12 sessions, and if required, another few booster sessions are given, and their pain scores are, literally speaking, reduced to tolerable level. Patients is able to tolerate it. And most of the patients, once they're treated for cancer pain, they don't need to rely on very strong pain relief medication like opioids or morphine, those type of drugs. So that is also a very good indication. It was FDA approved in the beginning to treat Calmare therapy apart from nerve pain, oncological cancer pain as well. So we are seeing a lot of interest in Calmare therapy. Unfortunately, Calmare therapy is not widely available. We don't know why. I'm the sole provider here in Ireland, and thankfully, I'm able to treat many patients with excellent results. Patients come and attend me here in Kilkenny, Ireland. Yet it is quite common therapy available in the United States. So sadly, there is less awareness of Calmare therapy in the medical profession as well, or scrambler therapy, but this is FDA approved treatment, and it has shown excellent results once we treat it without the use of drugs, medications. So a good thing is, just to summarize, Calmare therapy is fairly well tolerated by the patients. There's no pain felt during the Calmare therapy treatment, easily tolerable. We see immediate pain relief, good results without the use of any medications, with no side effects. There are no known side effects seen so far with Calmare therapy, which is excellent as compared to side effects seen with all these painkillers. So if you want to contact me, you can always get in touch with me on my website, which is www.arthritisandpainclinic.com. So www.arthritisandpainclinic.com, or you can email me at rheumatologyclinics rheumatologyclinics@gmail.com, rheumatologyclinics@gmail.com, rheumatologyclinics@gmail.com. You can also contact us at our local number in Ireland, which is 003534 for Ireland, followed by 567775146. So I'll repeat the number again. To dial from outside Republic of Ireland, the number is 00353567775 146. Thank you so much and have a nice day. Bye bye.